Hello, good day everyone. We are the Group 4 and we're going to discuss the topic about basic medical image processing and analysis. By the way, my name is Danjo and Monarba, and together with me we have Isin Faith Yucor, Angeli Maricatan, Francois Paculanang, and Jericho Mailan. Our topic focuses on medical images. So let's start. So what is medical images? Medical imaging is a technique and process of creating visual representations of the interior of a body for clinical analysis and medical intervention, as well as visual representation of the functions of some organs or tissue, or physiology. It also helps for early detection and diagnosis of diseases. So now let's move on to quality evaluation. Medical image quality assessment, or MIQA, is of great significance to the development of medical imaging technology, which is widely used in computer-aided detection and diagnosis of diseases. MIQA evaluates the quality of images according to how well they offer useful and effective presentation to assist with physicians in diagnosing, which is greatly different from the purposes of natural image quality assessment. The figure of merit in expressing the quality of an image is frequently a signal-to-noise ratio. This measure provides an indication of the strength of the signal or effect enabled by the image manipulation of interest. Signal-to-noise ratio provides a measure of the discriminability of the object from its background and might be expected to change as, for instance, different contrast enhancement methods were applied to the image. Similarly, for the task of estimating the volume of an object, a signal-to-noise ratio can provide a measure of the magnitude of the effect adjusted by the variability in the object observed estimates. The signal-to-noise ratio as an image quality outcome is an informative indication of the extent and consistency with which the diagnostic truth is determined. And now let's move on to statistical analysis and information entropy to be discussed by Jericho Mailan.
Statistical analysis and information entropy. Statistical analysis, the digital image processing and analysis information and image are methods that become increasingly important in many technical scientific fields. Methods for acquiring, showing, filtering, and segment of image are briefly covered in the first part of the course, including methods for performing quantitative measurements in image. Examples are medical imaging, microarrays, fingerprint analysis, remote sensing, two-dimensional electrophoresis gels, and particle diffusion. Information entropy. Entropy is a measure of the randomness or disorder of a system. The value of entropy depends on the mass of system. It is denoted by the letter S and has units of joules of Kelvin. Entropy can have a positive or negative value. According to the second law of thermodynamics, the entropy of system can only decrease if the entropy of another system increased. Entropy is the measure of the disorder of a system. It is an extensive property of a thermodynamic system, which means its value changes depending on the amount of matter that is present. In equations, entropy is usually denoted by the letter S and the units of joules per Kelvin. A highly ordered system has low entropy.
Coding and decoding. Medical coding takes the descriptions of diseases, injuries, and healthcare procedures from physicians or healthcare providers and transforms them into numeric or alphanumeric codes to accurately describe the diagnosis and the procedures performed. Three types of medical codes. Number 1, International Classification of Diseases or ICD. Definition. These are diagnostic codes that create a uniform vocabulary for describing the causes of injury, illness, and death. Number 2, Current Procedure Terminology or CPT. Used to document the majority of the medical procedures performed in a physician's office. Number 3, Healthcare Common Procedure Coding or HCPC, a collection of standardized codes that represent medical procedures, supplies, products, and services. Medical decoders, also known as health information technicians, gather, process, and organize medical information in accordance to medical and insurance coding. They use medical software to assign codes to different diagnoses and procedures a patient has received for the purpose of billing. Medical decodes, reading medical bills, searching terminology, entering codes into a computer program, communicating with healthcare personnel.
Stable and unstable signal processing. Signal processing is an electrical engineering subfield that focuses on analyzing, modifying, and synthesizing signals such as images, sound, and scientific measurements. Also, it refers to analog and or digital manipulation of a signal. The signal could be an electric current or voltage, as is the case in magnetic resonance imaging. BIBO stands for bounding input and bounding output. BIBO stability is a system property that any bounded input yields a bounded output. Stable system. It satisfies the BIBO condition. For a stable system, output should be bounded or finite. For finite are bounded input at every instant time. Unstable system does not satisfy the BIBO conditions. Therefore, for a bounded input, we cannot expect a bounded output in case of unstable systems.
Transformations. Registration is the determination of a geometrical transformation that aligns points in another view of that object or another object. There are two types of transformations: rigid transformations, non-rigid transformations. Rigid transformations, or also known as rigid mappings, are defined as geometrical transformations that preserve all distances, preserve the straightness of lines, and all non-zero angles between straight lines. Rigid registration problems are registration problems that are limited to rigid transformations. There are two components to the specifications: translation and rotation. Non-rigid transformations are important not only for applications to non-rigid anatomy but also for inpatient registration of rigid anatomy and intrapatient registration of rigid anatomy when there are no non-rigid distortions in the image acquisition procedure. Number 6. Pre-medical image processing, image reconstruction, background removal, noise removal, image compression.
Image reconstruction. Reconstruction is a recover the spatial distribution of the parameters such as the X-ray attenuation coefficient or radioisotope concentration inside the body from external measurements and non-invasive when the behavior of the parameters determined as a function of depth within the body. The resulting image is tomographic, and the procedure is termed tomographic image reconstruction. The essential feature of this procedure is that the image is reconstructed from projections of the underlying distribution. Image reconstruction from projection is a problem that risen rapidly over the past 30 years in a wide variety of different disciplines as diverse as electron microscopy and radio astronomy.
Background removal is a kind of image segmentation which applies segmentation techniques to get the interested part in VHD or vision human data and remove the background part. Background activity removal. One of the first steps to be completed in the medical image processing is removing the background activity. This procedure is based on image segmentation, as in order to achieve the background activity removal, the organ's boundaries are first defined. The steps in this procedure are the following. The image is read. Second, the image is appeared. Third, a gray level threshold is decided by MATLAB. Fourth, the image is transformed into binary image in order to isolate the two kidneys. Fifth, the binary image is multiplied by the initial one. Sixth, the final image is appeared. Seventh, the color can change or not according to individual's needs. The following example of kidneys image describes the process.
Noise removal. Noise is caused due to various sources which include many external causes in transmission system and environmental factors which includes noise like Gaussian, Poisson, blurred, speckle, and salt and pepper noise. Noise removing method has become an important factor in medical imaging applications, and the most commonly used filters are median filter, Gaussian filter, Wiener filter, which gives the best result for the respective noises. The need for the smoothing of images has become essential, which is required to remove the noise, and for that, best filter or standard filters are used in most of the image processing applications. The important asset of a good image denoising model is to remove the noise from the image and also preserve the edges. There are two types of models which are used for denoising, linear model and nonlinear model, and generally, linear models are used because of its speed. A limitation is that it is not able to preserve the edges in an efficient manner. This data is observed by using filters and finding out the best filter on the basis of the histogram, size, and clarity of the MRI images given to these filters.
Hi, I am Francois Pakulanang. I'm going to discuss about image compression. Image compression seeks to reduce the numbers of bits involved in representing an image. Most compression algorithms in practice are digital, beginning with an information source that is discrete in time and amplitude. If an image is initially analog in space and amplitude, one must first render it discrete in both space and amplitude before compression. Discretization in space is generally called sampling. This consists of examining the intensity of the analog image on a regular grid of points called picture elements or pixels. Discretization in amplitude is simply scalar quantization, a mapping from a continuous range of possible values into a finite set of approximating values. The term analog to digital, or AD, conversion is often used to mean both sampling and quantization. That is, the conversion of a signal that is analog in both space and amplitude to a signal that is discrete in both space and amplitude. Such conversion is by itself an example of lossy compression. That would be all. Thank you.